Thank you. Good evening, everybody. This is yet another IBIL event. We don't let little things like COVID stop us. Actually, sometimes it makes it bigger. And I see we're now to 107, moving up. Maybe I should take bets on how many people come in the end. This panel, I've never heard of a panel like it, especially devoted to pharma trademarks. And with people who really understand it. My function tonight is to say hello to you all, to encourage you to come to the wonder.me meeting afterwards, which is like a sort of cocktail party without the cocktails, bring your own, where you can meet people and move about just like a real cocktail party. But of course, you may be off to supper or something otherwise. My other task at the very beginning, because I'm not going to come back to you at the end, is to thank our speakers who've all been so kind to come and join this amazing event. And to thank Ilana, whose idea it was, and who did so much to put it together. I'm now going to back out. Your chairman this evening is Ashton Chantrell from my old chambers, which is where I have to say, UCL is a very good academic institution, but if you really want to learn IP, you do it in 8 New Square. Ashton, you're on your own. I'm going mute.
Thank you, Robin. Good evening, everyone, and thank you very much for coming and to watch our talks. As Robin said, I'm Ashton Chantrell from 8 New Square. We have some wonderful speakers. This evening who I will introduce just in a moment. And I just wanted to say that there'll be a Q&A at the end as usual. So please put your questions into the box and I can put them to the floor at the end of everyone's talk. Sorry. So our first speaker is Joëlle Senit-Hugo, who is the Principal Counsel at Sanofi. She's also a member of the Pharmaceutical Trademarks Group Management Committee and of the European Federation of Pharmaceutical Industries and Associations Trademark Subgroup. Joëlle will be giving a talk on the creation and clearance of brand names in the pharmaceutical industry. Then we will hear from Alexios Skarlatos, who has been head of the labeling office within the committees and quality assurance department of the Human Medicines Division at the EMA. He is also chair of the Name Review Group and chair of the Quality Review of Documents Group. Alexios will give a talk on the EMA's perspectives on the review of invented names. Third, we will hear from David Lossignol, who is a global head of pharma legal brand protection at Novartis Pharma. He was also the president of the International Trademark Association, INTA, in 2019, and he will be giving a talk on the opportunities and challenges for non-traditional pharmaceutical trademarks. And then last, but of course not least, Gordon Humphreys, who is currently chairperson of the first Board of Appeal at the EU IPO. He's also an accredited mediator with the Chartered Institute of Arbitrators and is a member of the EU IPO Boards of Appeal Mediation Service. Gordon's talk will be about the case law relating to confusion and the relevant consumer of the pharmaceutical trademark. So without further ado, I will pass on to Joëlle.
Thank you. So good evening, everyone. Let's start now, and thank you, Ashton. So a pharmaceutical product has two brand names. First of all, if you look to the right of this packaging, a common name, which is called an INN, International Name, and which corresponds to the active ingredient of the pharmaceutical product. Within this stem, there is a specific part called stem, which relates to the pharmacological properties of the drugs. In our example, the INN is clopidogrel and the stem is grel, which corresponds to the platelet aggregation inhibitors. And for the doctors, this part is very important because this is how they can automatically recognize the products they are facing. This evening, I will not tell you how we can develop such kind of common name, but I will only concentrate on the trademark brand name, such as Plavix in our case. And I will focus on the naming of new innovative medicines. I will not tell you how we can develop trademarks for OTC products, over-the-counter products. So the challenge for pharmaceutical branding is as follows. In fact, our pharmaceutical trademarks are reviewed first by the trademark officers, but also by the health authorities. And health authorities have a more stringent assessment process with varying approaches and standards depending on the countries. And the two processes are completely independent of each other, which means that the health authorities do not take into consideration the trademark registrations. Also, within our companies, usually the marketing teams desire a global brand, which means a single brand which will be registered on a worldwide basis by the trademark officers and which will be also accepted on a worldwide basis by the health authorities. We also all have in mind the patient safety. Of course, we want to avoid medication errors due to potential confusion between two pharmaceutical trademarks, and these confusions may have dire consequences for the patients. So having this in mind, of course, we need to start early during the clinical product development or brand development. Usually we start with the brand creation when the product is in phase 2. That means 3 to 4 years before the product launch. When we start this development, of course, we must have a brand team, and the collaboration within the brand team is essential. We have internal stakeholders composed of the marketing people, regulatory affairs, medical members, intellectual property, trademarks people, and business sponsors to validate the names at each step of the process. In addition, at Sanofi, we are also working with an external stakeholder, a branding agency. This help is very important because naming a pharmaceutical drug is an art. It's a long and complicated process, and we cannot manage that internally. We can summarize the creation process for global brands in this inverted pyramid. First of all, we will have the names creation by the branding agency, and the agency will also conduct a first trademark pre-screening. The agency will present list of names to the brand team, and the brand team will select and rank their preferred names. This means that at that level, we may have 200 or 300 names created and reviewed. And hopefully, at the second step, we have 50 to 70 names available for trademark clearance, full availability searches in as many trademarks registers as possible. After this legal filter, we have 15 names available for marketing and safety research and linguistics. Then after this additional filter, this is time for the final analysis and brand name selection. And hopefully at that level, we have 4 to 6 brand names, 2 favorite names plus backups ready for trademark protection, and thereafter in the process, health authorities pre-submission. Let's view in a little bit more detail each step. First of all, the names creation. The names creation follows a specific methodology. First, we will concentrate on the product overview, the description of the product. We will identify the patients concerned by the product. Also, we will look at the competitive landscape. We must not copy the brands of our competitors. And we will determine the creative directions, the concept, the ideas to promote. In other words, we have a product. What do we want to promote? And we will have discussions internally and with the branding team. And we will highlight the unique values of the product, what the patients can gain by using our product, What do they expect from our product? Also, what are the attributes, the benefits of the product? What is our vision, our goal, our ambition for this product? Also, we may consider the kind of images we have in mind when we think about this product. The objective of these discussions is really to develop a lot of ideas. These will become part of the creative basis for the name generation. The ideas will be embedded and slightly embedded into the new names created. And this is how we can develop different brand name styles. For instance, we may want to refer to the indication therapeutic area. Comirnaty is the trademark for the COVID-19 vaccine developed by Pfizer and BioNTech. And this trademark combines COVID-19, mRNA, and also the idea of community and immunity. We may also want to highlight an attribute, a benefit of the product. Lucentis, trademark of Novartis and Genentech, is for the treatment of certain side problems. And this trademark encodes reference to Luce, Lucent. We also want to develop a more aspirational, imaginary, indicative trademarks. Visimpro is a cancer medicine of Pfizer. And Visimpro includes Impro, and Impro refers to possible life improvement. So a very nice message in this trademark. Victoza of Novo Nordisk evokes a real world victory. Of course, we may also want to develop blank canvas, empty vessel. These are names which have absolutely no specific meaning, but they are highly distinctive. Praluent, our own product developed with Regeneron, is a medicine for lowering levels of fat in the blood. Gilenya of Novartis is for the treatment of multiple sclerosis. Of course, during the names creation, we must not forget the trademark criteria you know about. First of all, our trademark should be distinctive, not descriptive. And there is a specificity for the pharmaceutical domain. The World Health Organization has issued a resolution in 1993, and this is a kind of soft law, according to which trademarks should not be derived from INNs and should not use a stem. Of course, this is subject to interpretation, but we must comply with the rules when we are developing new trademarks. In addition, our trademark should comply with public order and morality. And of course, our trademark should not be deceptive or misleading. Once we have a certain number of trademarks, we can start the availability searches. And of course, we must apply the trademark criteria you know. Our trademark should be available, not infringe third parties' earlier rights. And this means that it should not be identical, of course, or confusingly similar to earlier third parties' trademark rights, identifying identical or similar goods. The similarity between two pharmaceutical trademarks is evaluated according to the major principles you know, as for the other categories of trademarks. And we will take into consideration the overall impression between the two conflicting trademarks, also the visual, phonetic, conceptual similarity, if relevant, and we will analyze the distinctive and dominant components. Regarding the earlier third parties trademarks, we must pay attention to its distinctiveness. For instance, for sure, we must not have a trademark presenting similarities with VIAGRA. Regarding the goods, we have some specificities in the pharmaceutical domain. We are conducting our searches in class 5 and also in class 10. And the problem is that the trademarks databases in class 5 are overcrowded, whatever the country, whatever the register. And this is a hurdle for us. Also, under the term pharmaceutical preparations, we also include as identical goods veterinary preparations, herbal and homeopathic medicines, and testing preparations. And for sure, this means that during our availability searches, we will face a lot of hits, a lot of results, probably concerning these kind of products, but we must take them into account. Regarding the similarity between pharmaceuticals, the EU IPO guideline provides some information. Specific pharmaceuticals are similar to other specific pharmaceuticals. However, the degree of similarity may vary depending on the specific therapeutic indications, and the guideline provides some examples. I must say that when we are conducting our availability searches, we do not operate this distinction, and we tend to consider that specific pharmaceuticals are similar to other specific pharmaceuticals. Of importance, the guideline reminds that dietetic substances adapted for medical use, cosmetics with medical properties, and plasters are similar to pharmaceuticals. It's important to take that into account when we are doing our availability searches, even if from a regulatory point of view, probably we will not face difficulties with the health authorities. In addition, we have other specificities for the pharmaceutical area. The relevant public to consider is composed of the general public, the patients and users, and the health professionals, doctors and pharmacists. And according to settled case law, the general public is more prone to confusion, which is true. Regarding the degree of attention, the relevant public is supposed to have a relatively high degree of attention for any kind of pharmaceutical products, meaning pharmaceuticals either sold under prescription or sold without prescription, the famous over-the-counter products you may buy at Boots, for instance. The reasoning behind that is pharmaceutical goods affect the state of health, and therefore the relevant public is more attentive. This may be true, but probably not in all cases, and we face difficulties when the patients are aged. And also we all know that the doctors and pharmacists are extremely busy, and probably sometimes the degree of attention is only average and not high. In any case, this high degree of attention has an impact on the case law, and the likelihood of confusion is more restrictively interpreted between two pharmaceutical trademarks. Of course, in each case, we must pay attention to the trademarks concerned and also to the goods, but this is the trend. This must be balanced because when we're conducting our availability searches, we go beyond these special considerations. And at Sanofi, we tend to consider that we must pay attention to patient safety. And we apply a stricter approach when we conduct these availability searches, having also in mind the health authorities' criteria. I was telling you that our objective is the global brand. So this means that we cannot limit our searches in the EU, and we must conduct availability searches in a large number of regions. And this is where the role of the in-house trademark attorney is key. We have to define the availability searches strategy for each project. Of course, we always adopt the cascade approach to minimize costs, and we put in place a step-by-step elimination process. But we identify a prioritized list of countries and registers per project. We start with the global data, and this register is very valuable in our industry because we have information about all the pharmaceutical products on a worldwide basis. when I say all, well, maybe there are some limitations. First of all, over-the-counter products may not be listed, and also products with a limited amount of sales are not listed. And also we know that some countries are not referenced, but generally speaking, this data, this register provides a very good overview of the market. And for us, it means that we are eliminating a certain number of trademarks on the basis of these results when we think that products already on the market present similarities to the trademarks we want to adopt. Then for the surviving candidates, we can proceed with availability searches in the trademark registers, such as the EU, USA, Canada, and then other registers, depending on the projects. At some point in the process, this will be time for the trademark attorney to compile the searches results and to prepare a consolidated report with ratings of names by level of risk, meaning low, no serious obstacles have been identified. Medium means that names may be subject to challenge, but appear legally defensible, and high correspond to the names to be dropped. And the challenge for us is that similarity is a subjective notion. And we have this multi-countries approach when we prepare this consolidated report. And to give you an example, we may have, let's say, reports originating from 8 different countries. And in 4 reports, a trademark may be cited as a potential obstacle. And these trademarks will not be cited in the other reports, although it is existing in the other trademark registers. So what do we have to do? Do we keep that candidate, or do we decide to eliminate the candidates? This is the challenge for us. Of course, we have to take the decision. We have to take a risk, and of course, thoughtful risk, because thereafter we know we have to convince the marketing teams, the regulatory teams. We have to influence them and also explain them why we are just eliminating the names they prefer. Legal screening and this legal filter, we should have 15 names available for marketing and safety research. For this research, we work in collaboration with a branding agency. And the agency is recruiting health professionals in specific countries defined in advance. And the help of these professionals is very important for the safety testing. As I told you, our aim is to avoid brand name confusion and also potential problems for the brand name itself. So the health professionals are requested to assess the similarity between our new candidates versus the marketed pharmaceutical products they know by their experience. And they will also assess similarity versus INNs and versus medical terms or medical abbreviations. In addition, they will have to interpret written, verbal, and computerized prescriptions. Handwriting is important. As you know, the doctors are known to have an illegible handwriting, and this is where confusions may arise. So these simulation studies are very important. In addition, the health professionals will assess the quality of the names. Are they inappropriate, exaggerative? Do they contain a promotional claim, even if subtly embedded? Then we assess the marketability of our names, the market attractiveness of our names. Do they fit to the product concept? We also evaluate the attribute benefit we want to communicate with our trademarks. Also, we check the memorability of our names, their ease of pronunciation. And we also request health professionals to express their personal preferences with rationale. Last but not least, we are also performing linguistic screening in the major world languages, and this means more than 40 languages for a global brand. This screening is helpful to identify pronunciation issues, which may result in problems when prescription are taking place. And also we will identify negative connotations, associations, and slang, and this in order to avoid a trademark contrary to public order or morality. After all these trademark evaluation, this trademark checking, this is the time for the final selection of the trademarks. And the brand team will review the trademarks availability searches report, also the marketing and safety research and linguistic report, and will select the most promising brand names for submission to top management. And we will identify 2 favorite names and backups. And then it's time for filing of the names at the trademark offices, and thereafter pre-submission of names at FDA and EMA or vice versa. Thank you for your attention. And Ashton, the floor is yours.
Thank you very much, Joelle. That was extremely interesting. There are some questions for you, but I'll come back to that right at the end once everyone has had a chance to speak. So next up is Alexios.
Thank you very much, and good evening, everyone. So we can go directly to the first slide. I will just go through the first the legal framework within which we operate in order to clear naming proposals. As you probably know, we have the rule of the single name for throughout the European Union, and that's stipulated in Article 6.1 of our regulation. And also in Article 1 of the Directive 2001/83, we have a description of what we consider as a name of the medicinal product. So we may have 2 possible scenarios, which is what we call the invented name or trade name, as you probably know it, but also the combination of a common or scientific name, so the INN, as Joelle was referring to, together with the trademark or the name of the marketing authorization holder, the name of the pharmaceutical company. If we go to the next slide, please. The only deviation exception to this rule of the single name is Article 6.1 of Regulation 726/2004, which is a rare occasion where on the basis of trademark law, we may allow for an exception to the single name rule. This is indeed a very rare scenario, and it has, in my lifetime in the agency for the last 20 years, it only appeared twice, and it requires an explicit decision from the European Commission. If we go to the next one. So who is responsible at the EMA for clearing the names? So it's the name review group. It's one of the oldest working groups we have in the agency. It was established in 1999, and it's a satellite group accountable to our scientific committee. It is composed of overall 50 contact points sitting in the different national competent authorities of the EU member states. And there is a core group within this 50, the 15 members who are distributed according to language groups. And they are the ones who are meeting regularly, face-to-face, virtually in the last 12 months. Plus another expert on patient safety who has no attachment, no links to any of the national authority. In the next slide, you will see the distribution, as I mentioned before, the language groups, and some of them are representing, not all of them are sitting in this 15 core group, but some of them are representing the language teams. And then we have the European Commission and the WHO, who are also consulted in this exercise, but they are not legally participating in our meetings. Next one. Yeah, and these are what shows on your screen are the ones who are actively participating in the core group. We can go to the next. So what is the role? As Joël mentioned in the previous presentation, we do not take into consideration legal aspect of trademarks. Our main aim is to avoid any confusion, any public health concerns or potential safety risks with the confusion between names of medicinal products. And these are some of the most common grounds for rejection of a proposed name. 80 to 85%, it's relating to confusion with the name of an existing medicinal product. Of course, we can have misleading therapeutic pharmaceutical connotation or composition. The promotional aspects are also quite important. Obviously, in a context of 24 official languages, offensive inappropriate connotation is quite common. And finally, the protection of the INN or the INN stem, as Joël was alluding to her presentation. And obviously, the overall aim of this review is to prevent any medication related to name confusion. Next one, please. This is a slide which gives you an outline of the procedural aspects. So we have a number of proposals that we receive according to certain deadlines, time points within the year. We at the EMEA, the Secretariat, will populate this draft agenda, which is shared in this network of 50 representatives. We give them a certain deadline and they are doing their own searches. We are doing our own searches through our database and they are doing through the national databases. And of course, they're taking care of all the linguistic aspects. All these objections we receive, we put them in a common document and then we meet in face-to-face with this core group of the 15 members that I described before. We go one by one. It's a very tiresome meeting. Nowadays, it takes 2 days, 2 full days, to clear up around 100 names, plus the appeals, plus reuse, plus INN, plus company name. So at the end of the day, I think we are all exhausted. Then the outcome is formally endorsed by our scientific committee. We will communicate to the applicants the outcome, and then we have the phase of the appeal, what we call the justification. I can note in the, here that there is no restriction in the number of times a company can appeal. It's unlimited. And we don't put any restriction. This year we met 6 times. Usually we have 4 meetings a year, but this year was particularly busy because of the COVID crisis. There was a quite big backlog that we had to clear out. So we had 2 extra meetings, and that helped also this virtual situation because we didn't have to organize face-to-face ones. It was much easier. Next one, please. Yeah, maybe we can skip these arrows. Yeah. So the Energy Guideline is a document, the basis which describes all the criteria that we use to reject or to approve a name. Up to 2 names, there is a limit. Up to 2 names are acceptable to be submitted. And this document obviously describes in details all the criteria that we may use to take our decisions. But most importantly, in the last few years, we have introduced this checklist, which is a kind of a template where we first go through the phonetic and orthographic similarity and we identify whether it's high, medium, or low. If we see that it's low, of course, it stops there. The name goes through. If, however, in one of the 3 elements or in all 3, speech, print, handwriting, we see that there is a medium or a high degree of similarity, then we will continue considering the setting. So the prescription, the dispensing, the preparation or the administration of the product, as well as the controls that probably are in place. If we're talking for an oncology product, obviously it's been administered by a specialist in a controlled environment, etc. All these elements are being taken into consideration. And then we go to the specific features of the product and 2 products that are up for potential confusion. So the pharmaceutical form, the route of administration, the legal status, potential issues around the packaging and the labeling. And finally, one of the most important elements that we consider is the potential for harm. whether it's high, medium, low, or even not applicable, because we may have identified certain similarities, but if there are specific controls, or we know that it's an advanced therapy product with an OTC herbal preparation, probably the risk of confusion in practice is negligible, almost inexistent. So in that case, it will go through. Next one, please. That's just to give you an idea of the statistics for this year. We had 52% of acceptance. We had almost 500 names reviewed this year. This accounts for inventor names plus INN and the marketing authorization holder name. Just to give you a rough idea, compared to other years, it's more or less the same. We are marginally above the 50% margin in terms of acceptance. Next one, please. I think we skipped one. Yes, that one. I just wanted to make a specific reference to the concept of conditional acceptability. So we don't reserve names in the sense that an applicant will come, let's say that we'll have 2 names approved. They will go into the database. They will have a 3-year validity with another 3-year extension if they wish so. But if another new name comes and there is a class that we identify with something that has already been approved or it's in use, for example, a product has been submitted, it's ongoing, the evaluation, we will raise the objection and we'll inform the applicants of there is a problem. But at that point in time, the name still is considered acceptable conditionally. And what we offer as a possibility is that if both applicants agree, they give the consent to us, we can reveal the identities and they can enter into a bilateral agreement and find a solution. This is coordinated by us, of course, not a bilateral negotiation, that it's solely between the 2 companies. Next slide, please. And in my last slide, I'm going through a few points, trends that we have noted in the last years, in particular in the last year, in 2020. So there is an increasing trend of inventor names created using parts of the name of the marketing authorization holder. And we see repeated attempts of such a concept, which alludes to umbrella branding, something that it's discouraged by us, and most likely it will be rejected unless it is the first attempt. So if it's the first of product that there is a part or something that connects to the name of the applicant, it could be accepted. But if this is attempted more than once, it will be rejected. The same goes for when we have fixed dose combinations. So imagine that we have a product for a single component that has already been authorized. Then the same company will develop another product with a combination of a second ingredient or a third ingredient. Quite often we see that they are trying to create a connection between the monocomponent and the fixed dose combination. Again, this is something that will most likely be rejected. As you saw from our statistics, the acceptance rates, and especially if you compare it with the FDA, is rather low. And we take a conservative approach because there is a huge variety in the national practices amongst member states. So the electronic prescribing in a number of member states may be the rule. In other member states, maybe handwritten prescriptions can only also be applicable. So when we, for example, the reason is the handwriting, the objection, we can't really take it very lightly that, yes, there is electronic prescribing and everything will be sorted out there. Unfortunately, we have to take into consideration these elements, and sometimes we may reject. The INN is also a reason for rejection. So we have a rule that it's if a name is created of more than 50% of an INN, either its own INN or another INN, it will be rejected. And something that we see very often, that companies provide reports justifying similarities with other names of products, but very rarely we see reports that justify similarities with INN, and this is where we have the rejections. POCA is a software which was created by the FDA. It's a kind of indication of, it gives you a percentage of phonetic and orthographic similarity between 2 names. In the US, this software and the results of this software have a more decisive role in the decision making for us. It is used, but it is used as a tool of picking up similarities. It doesn't give us, for example, if it says 70% or 40%, it wouldn't mean much to us, but it will help us to identify the similarity, and then we will apply our own criteria. As you probably know, in the last 3 years, we are publishing every other month an updated table list of all the names of products which have been authorized in the EU, both centralized and nationally. And this is a very important tool for the companies when they do the searches. And we see, unfortunately, quite a number of poorly researched names which attract 8 and 9 and 10 objections. It's a horrible task for us. It takes a lot of time. It's a waste of time for the company. So we have, in the last couple of years, we are sending comments highlighting the very bad quality of the files and the unacceptable level of objections, which shows that the company didn't really make their due diligence. Another rule that we have is that whenever we see a name which includes fully the name of another product, adding something else, this is a 99.9% a reason for rejection. It will never go through. And finally, this is something quite new. In the last months, we started raising objections because of pronunciation. We do understand how difficult it is nowadays, especially in the EU context, to find an invented name that will go through. But we tend to see names which are composed of a string of consonants, completely impossible to pronounce. And although in the past, in such a case, we would raise just a comment and alert the applicant about this issue, nowadays we consider that being so difficult to pronounce or having so many different versions of phonetic pronunciation of the name, it is a ground of confusion. It is a possibility to confuse it with something else. For this reason, we have started raising an objection and the names may be rejected. And I think I've reached the end of my presentation, and thank you very much. Over to you, Ashton.
Thank you very much. That was obviously also very interesting. I will now pass on to David.
Thanks, Ashton. Welcome, everyone. So I'm here to discuss a bit about the non-traditional pharmaceutical trademarks. Joel mentioned that class 5 is a very crowded field, but strangely, we don't have proportionally as many non-traditional trademarks as in other classes. Next slide, please. What do we call a non-traditional trademark? I'll define that by exclusion of what is more traditional, meaning a word mark or something figurative like a logo or a tagline. This would be the traditional ones. Anything which is non-traditional would have like a sound, color, position marks, patterns, motions, multimedia, holograms. These are all non-traditional ones. We have a nice list coming from EU IPO, the EU regulations as well, and some of the countries, they have lists, which is never really exhaustive. It can be also a smell, and there's some other categories to go with. A key element is also the representation of these marks. Clearly, we need to be able to represent them in a way which enables the authorities and the public to determine the clear and precise subject matter of the protection. So that is part of the EU trademark regulation. The Sigmund ECJ judgment gives us a bit of some idea of what we need there. So the representation needs to be clear, precise, self-contained, easily accessible, intelligible, durable, and objective. So that's a lot to meet. We'll see along the slides that some of them that I will show don't necessarily have all of that. If it's a color, then you need to submit a reproduction of the color without contours and having a reference to a generally recognized color code. So that's generally the Pantone code. And if it's a combination of colors, then in that case, you really need to describe more clearly what the way that the color combination is arranged, so that and you would also refer to the color codes. and giving also an option that you had a description. So talking about the description, this is an option that you have when you file a mark. You don't need to put it, but it shall necessarily accord with the representation. So it cannot extend the scope of the representation, is to just to precise something. So for example, this is where you put the colors for color marks, or if you have colors for anything specific that you want to protect. I'll put down a few examples. So on your left, you do have the Levi's little red tag, and you have the description, how it's presented. That's a figurative mark. That was quite an old one, intended to cover now what we would be calling more a position mark. Then you have this nice fries pack of McDonald's, the Coke bottle that you can recognize next to it. And then you have a sound, which is the Intel sound that everybody is aware of. Next slide, please. So there is a question as whether there's compatibility between the non-traditional mark and the pharma sector. Is there a presumption of functionality? That's a question, because the pharma products, they're meant to cure and prevent diseases, and they are meant to improve the quality of life. So it's not an issue when it comes to traditional marks, but would anything non-traditional have a presumption in itself of aiming at improving the way that the product is working for patients? So like a shape, if I come with a specific shape, maybe it's aimed to improve the quality of life of patients. Or maybe the colors, they are useful to recognize specific categories of products. If I put red, maybe that sounds like an inflammation kind of. There's also an interest of patients and healthcare professionals. If we put the patients at the center of the equation, and someone who has taken a drug for several years, and all of a sudden you have a patent which expires, generics can enter. So there may be a need for him to still take a pill looking like the old one that he had in the past. Or in the same way, having the same color on the box that he used to differentiate from the other treatments that he's taking. In the same way that this can be useful for doctors and pharmacists, because the way that they prescribe, they're used to seeing a color of a box. And what we have to take also into account is that some non-traditional marks, they play a fundamental role, however, when it comes to the safety of patients, because they enable them to avoid confusing drugs between them. And here we really have the role of the trademarks, which is to avoid confusion that comes into play. Is there an anti-competitive risk? There is necessarily a tension between potential expectations from patients to keep having the same product in appearance, and the fact that competitors also want to use that, but on the other side, you want to make sure that your products remain somehow unique on the market if you are the originator. So there may be a bit of abuse there, trying to protect what is non-protectable and preventing generics from entering the market, or even competitors, other competitors. In the sense of, to that point, France has been very extreme because they came up with a provision on enforceability of IP rights when it comes to oral generic medicines. They decided that when it comes to oral medicines, the IP rights related to the appearance and textures of medicine cannot be used against generic manufacturers. Meaning that all the efforts that you've put, for example, to register the appearance of the VIAGRA pill, you cannot enforce that anymore against generics. Next slide, please. This is to show a few non-traditional marks. So on the left, this is a multimedia mark. This is one of the two already published marks in class 5, multimedia. Next to it, on top, you have a sound mark. That is for educational services for multiple sclerosis and providing health information. So that's a Novartis one. And then you have some others that are existing, and some have been registered in some countries, some haven't been. Next slide, please. Here is just the key elements when it comes to the legal provisions. Of course, the distinctiveness we've discussed already, so I put down the provision here. But when it comes to functionality, there are three elements there that have to be considered. The first one is the product inherent functionality, the EI1. The technical functionality is the second, and the aesthetic functionality is the third one. So who is assessing the functionality? Because this is very important. Initially in the case law, we thought that the consumers would be the relevant public. But since we'll be talking about technical elements, they're certainly not the best one to assess that. So they can be taken into account to assess a perception of a sign. So what is the kind of the shape and what are the essential characteristics maybe? But other than that, any evidence of technicality can be accepted. So former patents, people in the field professionals in the field that would describe that as something essential as part of manufacturing or to save costs. So that's how it needs to be assessed. Next slide, please. So here I put down a few useful case law on functionality. They are non-pharma decisions, but they are kind of important because they set some kind of principles. There's the famous Phillips and Remington, which sets the reason why we have the Article 7E in place, 7.1E in place. You also have the Lego, which is important because you do have the idea that it's important to enable competitors to be able to use technical solutions. KitKat is also known. Of course, this is more some principles around the way that goods are manufactured that clarifies that the prohibition doesn't apply there. And there's another one which is a bit less known, I would say, but this one is a real saga in the trademark field because it went to CJEU, it went back to the General Court, and then again back to the CJEU. So quite a long process. And along the line, we discovered that all the essential elements have to be performing a technical results. And if you do have some non-essential ones and that are ornamental, that doesn't count. You can't have the mark registered. Next slide, please. So here, that's a Novartis case. We did file the patch that you can see on the left as a figurative mark in a few countries, including the EU IPO. Competitors, and we've been on the market for more than 5 years. It's the first patch that was existing in the neuroscience field, so it became kind of well known because it was a revolutionary way for patients for Alzheimer patients. And on your right, you have 5 shapes, appearance of generic products. So we did assert our rights against 2 of them, the one that are in gray with the dots around, because we considered those were the closest, and the one which is on the top left didn't have the dots. The one in the square on the right had a lot of dots, so we didn't go against that one. We were successful in some countries, and the manufacturer had to change and put more dots. And of course, the competitors and generics, they did file cancellation action. Next slide, please. The cancellation action went quite far because it went to the General Court, and Gordon ruled. Within the panel ruled in the Board of Appeal that the mark was not was functional, so you couldn't be protected because all the elements, the 4 key elements, which are the dots, the center, the square shape, and also the release liner at the back, they were all functional. And what made probably a significant difference in the decision was two patents that were pulled out where you could see the dots visible, and therefore that was assessed to be technical. Next slide. Here also the distinctiveness, you do have some examples around distinctiveness. On the left are marks which have, at the EU IPO level, been rejected due to lack of distinctiveness. And on the right, you have a set of marks which have been accepted. So you can see that the VIAGRA pill that you see on the left with Pfizer or VIAGRA has been accepted, but as a mere shape, it hasn't. It has been registered in a few national countries, however, so this is important to keep that in mind. Next slide. Here you have a set of inhalers, which have been filed in class 5 and 10 for the one in black and white. The issue with the first one at the EU IPO, the first ones, were that the EU IPO considered that the representation of the discus inhaler, so the disc ones, were not the same. So the top and bottom part were different. So the owner of the mark had to argue and finally managed to get that registered. The second set on the right in colors, this initially, I think, was filed as a category of other in the EU IPO. And then there was an examination which led to a reclassification to a 3D mark, and then with more precise color being described for those. So that's now there are proceedings ongoing for other reasons, for cancellation. But it was interesting to see how it was managed at the examiner level. Next slide, please. This is about some non-traditional mark in pharma field. So you can see here the case on the left was a color mark filed by a pharma company, which was initially granted protection. And there was a description which was arguably a bit unclear. And the question was, so this was raised at the UK level, and the court decided whether, whether the description or the representation is more important. And the court decided that none is superior to the other. There was also the question of if a trademark consists of exclusively one or several colors, may include variants or encompass variants of the protective sign. It's not only one sign. So there was a discrepancy found somehow between the representation and the description. The judge thought that there were three possible ways to interpret the trademark, and therefore the mark was cancelled and was confirmed on appeal. There's also a case which is still pending. I think it's now before the ECJ, the CJU, sorry. And this is a monocolor mark. And here the question is about, you have a monocolor mark covering a purple shade applied to inhalers and pharmaceutical products for respiratory disease. And the question is whether that's distinctive or not. So the owner was using this as a way to differentiate between the different compounds. And the question was whether that's in itself a problem. And also whether in the market, there were some companies using colors as a way to differentiate the compounds as well, and whether that plays a role on the color. So the case is still pending. The mark was cancelled at the general court level, but there's appeal proceedings ongoing. Next slide, please. So then there was a question, of course, Sandoz, which is a generic company, came on the market with an inhaler of that appearance that you can see on the left. And the owner of the color marks, which are on the right, whether that is infringing the color marks, which determines the scope of protection. So there were some proceedings ongoing in a few countries, including in the UK. Not only trademark rights were asserted, but also passing off and fair competition. So this led to different type of decision, which I'm sure that you'll be interested in reading, especially in the UK. The last slide, please. This is another case which is interesting. That's more in the US. Here you have on the left a generic pill which was launched. That was a generic of Nexium, of AstraZeneca. AstraZeneca has several marks on the market, and with their marks, they managed to get a PI against Dr. Reddy in the US. So Dr. Reddy had to relaunch in a blue collar. So that put them off the market for 3 to 4 months, which shows that non-traditional marks can be extremely useful to keep some, I would say, some recognition of the market that this belongs to one entity, and it shouldn't be taken by some others without any efforts from an advertising standpoint. So thanks, that's all from my side. Thank you, back to you, Ashton.
That's great, thank you, David. The purple inhalers bring back some memories, so I do concur. They're interesting decisions to read, so I recommend them in the UK. Right, so last but not least, last but not least, we've got Gordon, over to you.
Okay, thank you very much, Ashton. Hopefully you can see my presentation. Now, the good news is that all my fellow panelists have made my life very easy by really talking about decisions that I've taken and also what the EU IPO does. So I'll try not to repeat too much stuff, but I'm just going to obviously show you the bread and butter of what we do, which is obviously looking at this Article 8.1b on the likelihood of confusion, which is, as I say, our daily bread. Now, just to point out a few things here, I think the first thing is that, of course, if the goods compared are not similar, then obviously there's no question of likelihood of confusion. It's obvious, but it just needed to be said by somebody. And the second point that I'd like to continue with is also that there's got to be a likelihood of confusion for the relevant public in the relevant territory. So the relevant territory for an earlier EUTM can be any one part of the EU. Now, what that means is, of course, you get into all this argument about language and understanding of the relevant public. And as has been explained by previous speakers, we've got 23 languages in the EU. And what hasn't been said, of course, is you even have regional languages, which you may have to take into account as well. And unfortunately, not all the trademarks that we have to compare are word marks. Sometimes they're these, in the future, and they're going to be these multimedia marks. And we could also, at the level of cancellation, be looking at an earlier design and comparing that with a trademark. So all sorts of complicated things arise. Now, as we've already said, likelihood of confusion is a multifactorial test. It's based really on an overall impression when considering the similarity of the goods and services, and then the overall impression given by the marks, visually, phonetically, and conceptually, as we've said, from the perspective of that relevant public that I've just talked about. But also we have to think about the distinctiveness of the earlier mark. And as Joelle said, efforts, she said her company is making efforts to make sure that the marks they choose are distinctive. Well, that's good news. Not everybody is so diligent in that respect. And then, of course, we have this principle of interdependence, meaning that the more distinctive that an earlier mark is, essentially the greater its scope of protection, and the more easily we're likely to find confusion or a risk of confusion in those circumstances. And you have obviously the stable and Puma case well established in that area. Now, regarding the relevant public, we've heard before, again from Joël, that it can be health professionals. More usually, it's the average consumer, because nearly all pharmaceutical goods, at the end of the day, pharmaceutical products are taken by the average consumer. So although you may have two groups of relevant public, healthcare professionals and consumers, the case law actually says that you take the one with the lower degree of attention. Now, here, as has been pointed out before, with health products or products that affect human health, it's generally the case that a higher level of attention is going to be paid. However, that's not an invariable rule, and we'll see in one of the cases later that, in fact, most recently, that's not been applied. There are, of course, I mean, if you're considering something like athlete's foot powder, perhaps, you know, that's the level of attention people pay when purchasing that product is less than obviously a drug or pharmaceutical with much more serious effects on health. So I've already mentioned that we have to look at the earlier mark and decide you know, where it's protected. Now, obviously, you can bring national marks against national marks registered in any member state of the EU against, they can oppose a European Union trademark application. And we're going to have to look from the perspective of a member of the public in the territory of the earlier mark. And as I said before, if it's an earlier EU trademark, it's enough that there's a likelihood of confusion in any one territory. And in fact, a little later, we'll just see that this sometimes can be used to actually deem that there's a likelihood of confusion just for that, that part of the EU, and that's enough to keep the mark off the register. And it may mean that there are different appreciations of the distinctiveness of part of the earlier mark, a component of the earlier mark, or even the earlier mark as a whole. Okay, so when you're assessing similarity, again, all this from the case law, you're looking at the nature, intended purpose, method of use, and whether the products compared are in competition or complementary, whether they complement one another. In fact, the complementary nature is probably where one of the stickiest things that we have to look at. It's a thorny issue, and there's lots of argument because it has to be either indispensable or necessary or very important, the use of one product for the other. And we also look at distribution channels. Now, just a word on complementarity. In this case, Johnson & Johnson, Mon Bébé, in fact, there, it was comparing incontinence and baby napkins or diapers or nappies or however you like to call them, that were sold at the same points of sale. And they were seen as complementary to skin cleaning products. Because obviously you would need a skin cleaning product after dealing with the incontinence nappy or the baby's nappy. And interesting also, there the earlier mark invoked some level of reputation. It was enhanced distinctiveness, as we call it, whereby they showed via survey evidence that 80% of the surveyed women in Germany, which was the relevant territory, actually recognized this mark, and therefore it was recognized as having enhanced distinctiveness, and therefore the likelihood of confusion was established there. But that just shows how complementarity and enhanced distinctiveness can really make a big difference. Now, how do we put all these things together, and what's the right order? Well, last year, the Court of Justice decided to actually give the general court a bit of a lesson about this, because in fact this is again one of these cases that then it's not related to pharmaceuticals, but I've got it here because it tells us some important lessons. In fact, fortunately it confirmed what the boards of appeal have always done, but it just puts it down what should normally happen. So if there's even a faint degree of similarity between the trademarks compared, that's enough that we have to go through the whole process. I mean, obviously, assuming that there's some degree of similarity between the goods, you then have to move on to the global assessment and examine things like reputation and recognition of the earlier mark, like that Monbebe case that I just mentioned. You also have to look at the circumstances of marketing of the goods in the global assessment. So you don't, for example, when you're comparing the marks phonetically, you don't consider at that stage whether whether this is something that's going to be read out in the pharmacy, or whether somebody's going to simply come in and call for the product by name to the pharmacist or the sales assistant for an over-the-counter product. That's only done at the point of the global assessment, and you shouldn't do it before. And then this issue of what the court called counteraction of visual and phonetic similarities, sometimes called neutralization, which is basically where one of the marks has a specific meaning, then if that can be grasped by the public, then maybe that's enough to counteract the similarity of the visual and phonetic aspects of the mark. And that's established, in fact, taken from a case involving, broadly speaking, pharmaceutical products, these Sibotherm and Sibocalm, although they're obviously the Sibo, which were related to the skin. In fact, it was for antibacterial and anti-spot facial cleansing products, not very imaginative trademarks. Obviously, since they both had the stems of Sibo, there was a likelihood of confusion. And it was not the fact that there was therm, meaning referring to heat, and calm, as in calming, cooling down, that didn't, that difference at the end wasn't sufficient to counteract the visual and phonetic similarities. What the court then went on to say was, in fact, this neutralization or counteraction principle is really an exceptional one. And obviously, we've seen an example recently of where it has come into play, again, in a non-pharmaceutical context, between Messi, the footballer, and a cycle manufacturer called Massey, where the court held that Messi was entitled to apply for his trademark, and that there was no likelihood of confusion because Messi is such a well-known name that it invokes a concept that everybody will grasp and therefore distinguish the two marks immediately. Now, moving on to some recent cases, this Mar and Optimar case. Here, basically, the Board of Appeal found that medicated nasal sprays that was what the earlier mark was used for, as a result of after proof of use had been required, was similar to or similar or identical to various pharmaceutical products, but not to medicated dental rinses. So they said medicated nasal sprays are not similar to medicated dental rinses. Well, the General Court actually was not, well, they went through a comparison saying that nasal sprays and medicated dental rinses are in fact similar to a low degree, because the purpose of these goods are similar. They believe that they both could be used for treating the respiratory system. but they found, or the Board of Appeal had found that there was no likelihood of confusion, because despite conceptual similarity and a low degree of visual and phonetic similarity, the earlier mark was in fact had weak inherent distinctiveness, and the public's attention was high, and therefore they would be able to distinguish. Now the General Court actually upheld this decision and said that the public, the German public here, which was the relevant public, would actually relate Ma to the sea. And it was a well-known fact, which is a whole nother story about bringing in well-known facts. I haven't got time for that. They said that that was a well-known fact that nasal sprays are made from seawater or salt water. They also said the R symbol that you can see here was negligible. The figurative elements were pretty simple, and opti was potentially either laudatory, referring to optimal, optisch in German, or to the eye. And therefore, since the public had a high degree of attention for these products, there was no likelihood of confusion. Now, moving on to this other case, KISS and KISS Color, again, a case from the end of November of last year, so quite recently. The earlier the trademark applied for was for pharmaceuticals and cosmetic services and beauty care services for human beings, whereas the earlier mark was actually for basically implants for filling or wrinkle fillers. And basically the General Court agreed with the Board of Appeal that there was a likelihood of confusion. They got there by saying, well, the relevant public, the beauty sector professionals, plus the general public, or the beauty sector professionals for the class 5 goods, but the general public of the EU for the class 44 services, and their attention levels would be average to above average. I'm quite surprised that, well, some of the things I suppose were just for, for quite mundane, but the overlap was really in the wrinkle fillers, and I would have thought that people were paying attention for that. But anyway, that's a question of judgment. Then they also said that there was an average degree of similarity between all these cosmetic services and the wrinkle filling products, due to the fact that they were complementary. You needed, you would need one for the other, or they would be very important. And there was a certain impression of similarity between the marks, because the element ma, which was the sole component of the earlier mark, was completely reproduced in the mark applied for. And given that the mark only had, well, they said a normal degree of distinctive character, which was a little surprising, seeing as they had said that it was something that was related to seawater, that in the end there was a likelihood of confusion between the two. Okay, and then, oops, right, wrong way. Then the final case is this Apihil and Aprital. Just to say that Aprital is actually, it was an earlier Spanish mark, and Aprital is actually the leading child liquid aspirin or paracetamol. Traditional families have had it for years and years in Spain, very well known. And the court, though, here found that there was no likelihood of confusion between these marks. So they found that the cosmetics that weren't for medical purposes of the mark applied for were actually dissimilar to the opponent's antipyretics. And therefore, obviously, if there's no similarity between the goods, as I started off by saying, there can be no likelihood of confusion. And they also said, well, the fact that these goods can be used together sometimes doesn't make them complementary, because one is not indispensable or important for the use of the other. So no likelihood of confusion. And with that, I will end. Thank you.
Thank you, Gordon, for that. Now, we have quite a few questions here, so I'll ask them out anonymously and hand them over to one of our panelists. The first one is for Joël, and I'm just trying to work the system here, sorry. Right, so the first one for Joël. Post-Brexit, will the UK be in your list of priority countries for your availability searches? Oh, you're on mute, Joël. We can't.
Sorry. Yes, of course. Post-Brexit, UK will be part of the countries where we are checking the trademark availability. We do that currently because, in fact, when we are conducting availability searches, we look at the EU IPO register, but also at the national registers. And UK is part of our current availability searches, and we will continue to do so in the future. Of course. And also we will file an additional trademark in the UK, since now the UK is no longer covered by the EU trademark.
Great, thank you. And another one for you, actually. Are most of these databases publicly available, accessible?
Well, they are, you know, when we're working either as a trademark counsel or in the pharmaceutical industry, we have access to specific tools provided by specific providers like Clarivate or CoreSearch. But if you want to run a search, you can also go to the EU IPO website, and you can have some information. Of course, my recommendation would be to work with Clarivate or CoreSearch, or maybe some other tools I don't know and I do not use. I have also seen a question regarding the Pharma News database. This is only accessible through the Clarivate or CoreSearch, but this is really interesting for the pharmaceutical industry.
Thank you. There's a question here for David. Which do you see as the bigger challenge when registering non-traditional pharma trademarks, functionality or distinctiveness?
I would say distinctiveness, because the case I presented on functionality is one of the few that I found. There are not many that reach that level. So I would say that distinctiveness, there's a lot of issues when it comes to distinctiveness, potential, interpretation that it goes. There's a specific use for the public. People won't see it as a trademark because they will see it as something that can be useful, or color practice, or the shape of pills as well. How they have to be significantly different from the others to be able to be registered. So those, I think it's extremely hard to match. We did try with one that I presented, and we didn't go up to the end of going surveys and all of that. But you tend to have to prove distinctiveness through use with surveys, and it's quite difficult.
And Joël, would you do you have a view on this? Do you agree with David, or do you go the other way?
No, I agree with David. And in fact, we don't have many cases at Sanofi. So I do admire David for so nice cases, in fact.
May I weigh in on this?
Please do. I was coming to you next.
Yeah, just to say that I would say that even if you get through the hurdle of distinctiveness, and assuming that there's no functionality issue here, the problem then becomes if you get embroiled in relative grounds proceedings, so opposition or cancellation, what's the scope of protection of what you've got? Because as I said in my presentation, we have to do a global evaluation of the mark as a whole. And when it's a multimedia mark, I mean, God help us. We've got what are we comparing? I mean, with that very nice pill producer that we saw, I mean, is it absolutely everything in there? And if one thing happens to coincide with another mark, some aspect of another mark, is that enough? Or do we then look at say no, because there are all these additional features, therefore that's just lost, remembering that the consumer, the relevant consumer has an imperfect memory. So I see a lot of different, they look really nice, but enforceability, I'm not so sure. And even one of the first ones we had ran into trouble because it infringed inadvertently somebody else's mark that had appeared in their footage of the multimedia mark. So it's fraught with problems.
Thank you. There's a few questions here for Alexios. The first one is regarding the conditional approval. I think that was the conditional acceptability. Do you see many companies trying to resolve in case of potential conflicts? And how long?
No, actually, it's a quite rare occurrence. In 2020, for example, we didn't have a single case. I think, as far as I remember, we may have 5 to 6 such cases where companies gave their consent to reveal their identities and enter into negotiation. No, it doesn't happen very often. What it happens actually, it's something that scares the companies who have got a conditional approval, and most likely they will withdraw the name and try something new. So they don't make often use of this possibility. You're muted.
Mute. It always happens nowadays in these meetings. The EMA is, the questioner says that they understand that the EMA is more critical on pronunciation and that it can be a ground for rejection. Has this been announced?
Because no, it is in our plans for the next update, a revision of the name review group guideline. Unfortunately, because of our relocation from the UK to the Netherlands, the pandemic that came into right afterwards, we are in constant business continuity. So we have put on hold activities that are related to guidelines, etc. But it is in our plans. And of course, it will be put in consultation, whatever change we propose. But anyway, whatever rejections were based on pronunciation were communicated in details to the applicants in question.
And one more for you. The person who asked the question said, I don't think providing a safety report to EMA is a requirement so far when submitting a name, but it would be interesting to know to what extent such a report is considered by the EMA in the context of their assessment and what value is allocated. It's
true. It's not a legal requirement to submit a safety report together with a proposal for a name. However, it is quite important for us, and especially when we are in doubt for the setting of the medicine, the prescription dispensing. These are elements that we are trying to identify within such reports to help us take the final decision. So when in doubt, we do. Of course, consult them, and they are quite helpful in that respect.
I have 2 more questions here. Well, one question for Joël. Would it be better if the trademark registers around the world were less cluttered?
Wow, difficult question, in fact. Honestly, I don't know. Perhaps, but I'm not so sure. David, what do you think?
Well, there have been discussion about, extending the use requirement that exists, for example, in the United States or some other countries to avoid that you keep marks in the registries for years without using them, and then there are obstacles, sometimes even in some countries on relative grounds. It is a debate. You know, there are pros and cons. Yeah. There's a lot of efforts to prove use all the time in every 3 or 5 years. It's a lot of effort and risks. At the same time, we probably need to find a better balance. I don't know have the way to do it, but a better balance between all these marks that are unused and you know are bothering registries, and going into the direction of proving use all the time. So there must be a way to I think Gordon has something to say about it.
And also the difficulties for the pharmaceutical domain is that it takes time to develop a trademarks, have it registered. And in some countries, the registration is 3 years. And then if you have to prove use, we may lose our trademark rights. So it's true, use may be helpful, but there is a risk as well, specifically for the pharmaceutical domain and the duration of the development of a product and of a trademark.
Great. I've got one for you, Gordon. Oh, sorry, please go ahead.
Could I just come in on that? I can't resist on that cluttered register. Usually it's Americans that are coming in with that. But and I was actually going to say the solution of use. I'm not so sure, because Professor Barton Beebe and Jean Frommer of the New York Law School wrote a very interesting paper about, are we running out of trademarks? An empirical study of trademark depletion and congestion. So that's in the US. Now, obviously, they only have one language and we have 23, so we have a bit of an advantage over them. And the Max Planck Institute, when we had our legal reform some years ago, actually did address whether there was an issue of cluttering of registers. Actually, the EU's, if I dare say, a bit in denial about this. The position that's been taken is, well, this has never been proved, so therefore it doesn't exist. But I think maybe the upcoming cases about if use is the way to go are, well, we've had the SkyKit case, obviously, and there's a case called Monopoly that's that's coming before the General Court about this problem of evergreening, where people are basically perpetuating registrations they have a core of goods and services and then add a couple of things to them every 5 years, and then never need to show to prove use. So it is a problem, I think.
There's another one here for you, Gordon. Anecdotally, we've seen a few decisions from the EU instances where competing pharma marks that share a weakly distinctive element are found to be confusingly similar. Do you think the threshold for finding confusion between pharma marks is perhaps lower than for certain other goods?
I'm pretty sure I know who this question comes from. I think somebody wrote a book that mentioned this, but yeah, I would actually, I had this in mind when I had a look at the case law, and I think part of the problem is that with the exception of Joel's company that seems to be doing a sterling job at avoiding any descriptiveness, I fear that the others are not following suit, and that therefore there are an awful lot of descriptive elements components of these pharma marks. And the problem is that the case law of the Court of Justice and the General Court tells us that the low distinctiveness of an element or of a mark is just one element to take into account. It's not the only thing. The case law is, I admit, a bit all over the place, but I don't believe that there's some sort of great conspiracy that the EU IPO and the General Court are in cahoots to support the pharma industry and to the detriment of anybody else. So, by allowing upholding these marks where they're just descriptive elements in common. But I think the case law is evolving, and I think it's evolving, hopefully from what you saw in the cases that I showed it in a more positive way.
One more question, and this is for everyone. So please feel free to jump in when you figured out your answer. What would you consider a good trademark for a pharmaceutical product from your perspective?
Can I go first?
Yes, please.
A trademark which is highly distinctive and enforceable.
I would answer the same.
I don't think there's much to add to that.
Alexios, anything?
From my side, something very neutral. The opposite, I guess, from the others.
Great. Thank you, everyone. Thank you to all the panelists. Everyone was fantastic, very interesting talks. And thank you, everyone, for your questions.